could have easily kept to the topic and presented data in relation to tuberculosis, but this, what I'm going to show you is derived from a cluster, a pan-European cluster related to asthma. And one of the spin-offs, or one of the corners of the project, is to develop a new technology in relation to detecting multiple phenotypes of disease. And as I said, we're also detecting infectious diseases and others with the same technology. The basic concept is maybe something you're not used to, that in terms of medical technology, we're all used to more expensive $1 million costly developments in hospitals, only a few in particular countries. But I think the time is now come that this is completely turned upside down, that cheap technology available to the patient in its home, or at least in every doctor's office, really cheap technology, disposable technology, will help medicine further. And this is the example. So we are trying to capture diseases like asthma and the subclassification of those diseases with just a measurement in exhaled breaths by just cheap technology. So the example is children who wheeze, or children with asthma, and they are heterogeneous groups. Some have problems during their lifespan and others don't. And we know that we now, here actually today in Always, are exhaling all these fragments of metabolites that are coming somewhere from our body, mainly from the lung, but also circulating from other parts of the body. And just doing metabolomics, so do all the measurements of those metabolites, will perhaps and probably phenotype, so classify diseases much better than just measuring a single cell or a single molecule. So we are embarking into this metabolomics, and it has already been shown to be associated with inflammation, which was presented at one of these earlier meetings. So the aim of the study we present today here, or not yet, actually at this moment my colleague is doing that, is to discover these subphenotypes of children with wheeze or asthma from just the exhale breaths. Because children, you cannot really do a good history in children, you cannot do a real lung function, or even you cannot access the lungs at all, obviously. And just do that by highly sophisticated bioinformatics technologies. Those were not around 5 years ago, but they are around now. So the principle is that an electronic nose just captures these metabolites exhaled, for instance by this healthy person or a sick person, and just by capturing those molecules and recognize the composition, the instruments can just recognize, just based on probability, this fits in with a healthy population that the nose has seen, and this fits in with diseased population that this electronic nose has seen before. So it's just probabilistic reasoning, and this is highly powerful in medicine. So the technology is, these are the fragments that are being exhaled, just captured by cross-reactive sensors, and in fact our own human nose works exactly according to the same principle, which by the way was discovered after development of these instruments. So the instruments were developed, and then afterward the biologists discovered that our nose works the same way, which was the Nobel Prize in 2004. And just by making all these sensors in a circular graph, these are 180 of those sensors, you have this spider graph of two persons that are different along all those sensors, which gives you a real fingerprint. So we're measuring that in kids, and in the U-BIOPRED project, so a pan-European project on asthma, multi-countries contributing, young kids and school kids, and we have cross-sectional data, and this is just the first 100 patients, preschoolers, school-age kids, their age, and some of them are using drugs for asthma, some of don't, some are allergic, some don't, and some are heavily disturbed by the symptoms and some don't. And by just doing the bioinformatics trick by the sensors of the electronic nose, we were capable of, these are all the individual patients, to make sense of those individual patients by grouping them just by the electronic nose only. So we don't ask, we just do the breast fingerprinting, and the breast fingerprinting comes up as, in this case, 5 clusters of patients that the instrument says these are belonging together. These are sensible groups. And these sensible groups can be captured and visualized in this three-dimensional topological analysis, in which we, when capturing those groups that I just showed you in the beginning, are along those axes, the groups are in this picture captured in these circles, and the color of those dots, each dot is an individual patient, relates to whether it's a wheezy infant, an asthmatic infant, whether the disease is severe or mild. But the electronic nose captures this without knowing the patient's symptoms. And this is just a matter of 2 minutes in the doctor's office. And then we make these clusters and look whether they relate to the things we know, allergy, age, symptoms, etc. And the nice thing is here that some of the things like allergy and symptoms are recognized in particular groups, being, for instance, here symptom scores low and high, but some others are very similar with the traditional measurements, suggesting that these new technologies really capture new groups of patients that were previously unrecognized. So in conclusion, unbiased fingerprinting by just doing breath biomarkers provides clusters of children, in this case preschool wheezing and asthma, that associate with the things we know, but there is more than the things we know, and that's obviously what medicine, in this case, what we like, because these biological clusters may be predictive of the prognosis of these patients. And this is exactly what U-BIOPRED now is going to do. We're going to follow these patients up. At least it suggests that the metabolomics in exhaled air is suitable. It can be done very simply. The technology is cheap. It can be done in the doctor's office. And now we're going to predict, from these youngsters, these little preschool wheezers, hopefully by using this signal, who's going to develop asthma and who don't. Thank you.